everyone, today we're going to talk about Wilm's tumor or nephroblastoma. This is a rare kidney cancer that generally affects children under the age of 5. And it typically occurs in one kidney. What you'll typically find with these individuals is that there's a mass in the abdomen, and it is non-tender and firm, and it does not typically cross the midline. Although it can, it does not typically cross the midline. But many of these patients are often asymptomatic. When they do have symptoms, it's typically going to be things like abdominal pain. Sometimes we'll see that anywhere from 30 to 40% of patients. You can see hematuria, that can be anywhere from 12 to 25% of patients. Abdominal swelling, poor appetite, increased blood pressure, hematuria, nausea, and constipation. These are just among a few of the signs and symptoms that may happen with a Wilm's tumor. This, interestingly enough, there's an increased risk for African American children to develop Wilm's tumor, and it's really important to understand that not to palpate this. If it is identified, do not palpate an abdominal mass in a child. This typically happens most often in children under the age of 5, with the average find being around 3 to 4 years old. The reason why you don't want to palpate the abdomen, especially if it's vigorous palpation, is because, according to UpToDate, it can rupture the renal capsule and cause tumor spillage, and thus increasing the tumor stage. Another thing that I don't have listed here, but I did want to add, is that the lung is the most common site of metastasis.